Hi, good afternoon, everyone. So, today I'll be telling something about urinary tract infection in females. It is a very common infection in females, and yes, females are more prone to have urinary tract infection when we compare them to males. Why is it so? It is because of two reasons. Firstly, the urethra, that is the pipe which carries the urine from the bladder to outside, it is shorter in females. The size is 4 centimeter in females. When we compare it to males, it is longer in males. So the infection, the bacteria can easily travel from outside to the water bag, that is the bladder. Secondly, the opening of the urethra, that is the urethral meatus, it is quite near to the opening of the back passage, which in medical term is known as anus. So because of this, any bacteria near the anal opening can easily travel to the urethral meatus and can cause infection or UTI in females. That's why these are the two reasons why females are more prone to have urinary tract infection. But definitely there are some risk factors too which makes a female more prone to have urinary tract infection. What are they? We females, we have the habit, particularly the working females, we have the habit that we do not pee at set interval. Even if our bladder is full, we keep on delaying the peeing. This can lead to the multiplication of the bacteria in the urine and can increase your chance of urinary tract infection. So it's very important to pee at regular interval and when you have the desire to pee and not to postpone it. Secondly, females who are sexually active, they are more prone to have urinary tract infection because the vaginal opening being very near to the urethral meatus. Thirdly, the females who have kidney stones, because of the improper drainage of the urine, they can have urinary tract infection. Females who have diabetes, who are pregnant. Pregnancy is an immunocompromised state. So definitely pregnancy also increases your chance of urinary tract infection. If you are on certain medication which make your immune system low, OC pills also increase the chances of urinary tract infection, but to a lesser extent. Menopausal females, those who have attained menopause, the estrogen deficiency can lead to thinning of the lining of the urethra, and this urethra becomes more prone for infection. So postmenopausal state is also one of the risk factors. What are the symptoms? How a female presents when she has urinary tract infection? The most common symptom is that she'll have frequent desire to pass urine. This is known as urgency. She goes to the loo, then she has a desire and comes back and again she has the desire to pass urine. This is known as urgency. Then frequency, frequent passage of urine, burning in the urine. Then having pain in your lower tummy. If the bladder inflammation is there, the bladder is just in front of the your womb, that is your uterus. So pain in the lower tummy can be there. If the infection is severe one, you can have fever with chills. The urine can be cloudy in nature, and if it is a stone or you have blood, then it can be brownish or bloody stained urine can also be there. So these are some of the symptoms which you should be looking for: frequency, urgency, burning, pain in your lower tummy, having fever with chills. So these are some of the common symptoms which are associated with urinary tract infection. How do we diagnose urinary tract infections? To diagnose urinary tract infection, we need to check your urine, whether the urine is showing the presence of certain bacteria or not. We send the urine for routine microscopic examination where we are looking for the presence of pus cells or leukocytes in the urine. And if the leukocytes or pus cells are there, we send the urine for urine culture and sensitivity. That is, we check, we culture the urine whether there is any bacteria which is growing or any organism which is growing in the urine. Normally the report is available after 72 hours. And then according to the report, the antibiotics are prescribed to you. Now talking about the treatment, what is the treatment of urinary tract infection? Well, the mainstay treatment here is giving you antibiotics, and that is given according to the bacteria which grows in your urine, that is after your culture sensitivity report. Some symptomatic treatment like alkalizers can be given to you. You will be asked to drink lots and lots of fluids so that you flush the harmful bacteria in your urinary tract. For your pain relief, certain antispasmodics can be given to you. But the mainstay treatment is giving you antibiotics. And we do have various antibiotics which really work wonders in urinary tract infection. Some can be given, you can take orally through mouth, but sometimes the oral medication may not be sensitive to the bacteria which is growing in your urinary tract. In that case, you may require medications through in your blood vessels also, into your vein also. So that can also be there. So now let's talk about how we can prevent urinary tract infection. This is very, very important. Whenever we are peeing, we should be sure that the toilet area is clean, and we should be maintaining a proper perineal hygiene. We should always pee before sexual intercourse and after sexual intercourse. Whenever we are washing our lower down area, or after passing stools, we are using jet, it should always be from front to back. Never use the jet from back to front, and never use the tissue from back to front. Always from front to back you have to use tissue or your jet. Drinks lots and lots of fluid, so that any bacteria which is growing in the urinary tract, that is flushed out. You can drink cranberry juices. These are alkalizers, and they also do wonders in preventing urinary tract infection. Drinks lots of fluids, as I've already told. So these are some of the measures which you can follow. And if you have attained menopause and you are deficient in estrogen, you are having frequent UTI, you can use certain creams, certain ointments, that is the vaginal estrogen ointments can be used, which can make your mucosa more healthy. And after that you may have less chances of having UTI. So these are some of the measures which you can really follow in your day-to-day activity to prevent yourself from urinary tract infection. Hope the video was helpful. Any queries, you can just message me. Thank you so much.